The next speaker is Dr. Marka Zeltnera. He graduated in 2006 from the University in Zurich, and Marco is a specialist for reconstructive dentistry and a co-owner of a private practice in Horgen, Switzerland. But Marco is still very much involved at the work in the university as an instructor, I think half a day per week. In my opinion, Marco is a very good dentist because I sent my father to him to get a matrix implant, but he needed to do some socket preservation first, so unfortunately we haven't placed it yet, but I hope we'll get it done very soon. So I'm very happy to invite you to the stage, Marco, for your TRI talk with the topic TRI Matrix in Daily Practice. So welcome to the stage, Marco.
So, Sandro, thank you very much for the kind introduction. I swear that I will give my best that your father will feel in good hands in our clinic. So, dear colleagues, the young man standing in the middle, this is me during elementary school. And when I was about in the 4th or 5th grade, my classmates and I, we were given the task of conducting an interview with a working person who works in your profession of choice. And believe it or not, I interviewed the local dentist back then. Today, I don't remember exactly why I decided it that way at that time, but I probably realized that he was driving one of the nicest cars in our village. And I'm pretty sure that during my school years, my favorite job changed a few times, but in the end, I became one, a dentist in the private practice. And I still don't regret it because I love my job. My job is the perfect mix of applying theoretical knowledge and also practical manual skills. I can work in a great team, I am my own boss, and I have a lot of cool equipment at my disposal. And to be honest, usually you can also make a very good living with what you earn. But these are only secondary reasons why I love our job. What is the most important one? For me, this is crystal clear. It's just a great feeling when you help your patients and they leave the clinic happy and satisfied. And this applies to all areas of dentistry, but especially also to implant dentistry, because for many, many patients worldwide, it's a great opportunity to improve their quality of life by restoring function and aesthetics with implant-borne reconstructions. And I'm pretty glad that I had the opportunity to learn implant dentistry in depth at university. So thank you, dear Ronnie Jung. And so today I can help my patients with implant-supported reconstruction, and this with confidence and a very good feeling. So now you know that I'm a more or less happy dentist who likes to place implants, but why am I standing here? I think exactly for the same reason as you do or you watch, because I found out that it's cool to be open for something new. Integrating new techniques, new materials, but also new technology into everyday practice is like the salt and the pepper for me in the soup. And I get very excited if I think that something new can bring us further, and I don't hesitate a moment to apply it in dental practice if I believe in it. So what do we expect from new technology? I think there are different aspects, and one aspect is it should maybe lead to a better outcome, or then it should lead to at least the same outcome, but then improve the life of the practitioner. Or you can also use it if it has an added value for the patient. I'm thinking about reducing morbidity or a reduction in costs. So what is now for the matrix implant? Today we heard a lot about the advantages of the implant. From a biomechanical point of view, the reconstruction seemed to work with a very stable connection. We are completely free in the design of the emergence profile, and we use a very, very biocompatible material without any cement, and this at a very fair price and with a very easy workflow. But for me, in the private practice, something else is very important. With the matrix implant, I have somehow an all-rounder at my disposal that works with a very, very small portfolio of materials. So the surgical cassette is very simple and easy to use. And for prosthetics, I only need my scan bodies and an intraoral scanner. But what exactly do I mean by all-rounder? So in our clinic, we realized that the TRI implants are suitable for all implantation types in terms of timing, meaning immediate implant placement, but also early and late implant placement. And especially for type 1 immediate implant placement, the rather aggressive design of the TRI implants has advantages over the other systems I use in my clinic. And this is also true for the matrix implant, of course. Then I can use my all-rounder matrix implant in every region of the dental arch. So whether this is the anterior region or the posterior region, and I can use it not only for single implant-supported crowns, but also for implant-supported bridges, and even for removable prosthodontics. And there is another reason that I can speak about the matrix implant as an all-rounder, and I would like to illustrate this with these two patients. So these two patients were different in many ways, in their social life, in their concern, in their medical background, but they had also things in common. Especially one thing, both of them had one tooth which was irrational to treat. So here is patient number 1. He was not in pain, but he lost his tooth-supported crown in area of tooth 25. And after the clinical and radiographic examination, we had to inform him that the tooth need to be extracted. So at that time, this patient was 42 years old. He had a medium smile line, not very high aesthetic expectation. He was healthy, and he informed us that he's very busy and that he will leave soon for a job-wise journey to Berlin. And he also wished to replace the tooth as efficient as possible, not only in terms of time, but also in terms of costs. So after I have analyzed the situation again, I decided to go for type 1 implant placement. In order to reduce the number of appointments, because my patient was very busy, and because I was pretty sure that I can stabilize the implant in the apical portion underneath the maxillary sinus floor. So let's have a look at the procedure now. First of all, the tooth is extracted in a very automatic way. We always use a vertical extraction system called Benex in these cases, almost for every case in the aesthetic area. After tooth extraction, the socket is carefully cleaned, and then I prepared the implant bed with the according drills in a slightly palatal position, and then my matrix implant was inserted. After that, I grafted the remaining socket with a bone substitute. In this case, I also used a collagen membrane in order to allow for a submucosal healing because the insertion torque was not very high in this case. And here you see the clinical situation and also the radiographic situation after surgery and 10 days later. After that, my patient went to Germany and he returned 4 months later. And at the same time as a very minimally invasive abutment connection, a straightforward abutment connection was performed, we made also the digital impression, an optical scan with the according scan body, and we sent the file to our dental technician. And also in the lab, a very straightforward procedure was selected. So he designed the crown in one piece. It was sintered out of zirconia, colored and glazed. And here you can see already the pictures of the final crown. So a rather opaque look from the occlusal view, but a better color integration from the labial view, thanks to our gifted dental technician, Tobias Fischli. And here is the according X-ray with a perfect fit. So in this case, I selected a very straightforward procedure, and it was very efficient in terms of time spent in the clinic, but also in terms of costs. What about my other patient? So this patient was in pain because she had a vertical root fracture of tooth number 14. And after analyzing the situation, we had to inform also this patient that this tooth was irrational to treat. And when you look at the X-ray, you can again see that this is a good case for type 1 implant placement. And this made sense in her case to reduce the number of appointments because she was a high-risk patient and I treated her during the COVID-19 pandemic. So this patient was 76 years old, and even though she was a little older, she had high aesthetic expectations, and she had no financial limit. She came to my clinic and said, okay, I want to have a nice tooth there, the best tooth possible. So let's have a look at this clinical procedure. You see also the pronounced recessions at the neighboring teeth, so I wanted to address the treatment of the recessions in the same intervention. Therefore, we prepare a split thickness flap, a tunnel there. The tooth was extracted again with the vertical extraction system. We place our matrix implant in a slightly palatal position. We graft the socket again, and we cover it by a collagen membrane. So this time I have selected the transmucosal healing mode because the implant was very stable when I inserted it. And then to compensate for missing volume and to treat also the recessions at the neighboring teeth, I harvested a connective tissue graft and transplanted it to the recipient side. And here are the pictures after surgery with the coronally advanced flap and after the according X-ray. After 10 days, the sutures were removed, and then the patient came back another 3 months later. And you see the nice volume which we have created, and also a nice improvement of the recessions. Again, an optical scan was performed at this time with the scan body and the file sent to my lab technician. So this time, this was Dominik Reichhardt. He took his time to design the desired emergence profile, and he designed the crown already with the sort of cutback in order to layer the zirconia crown with some feldspathic ceramics at the end. We did one try-in, and this was the second shot, and you see now that this is a very nice outcome with the according X-ray. So in this case, we didn't select the straightforward procedure anymore, but we had a very nice outcome. So that means that my all-rounder implant is not only made for straightforward, inexpensive treatments, but also for high-end prosthodontics. We also started to implement the use of customized abutments and provisionals in our clinic. I cannot go into detail, and also my colleagues have talked about it in the previous lectures. This is a very cool option, and it makes a lot of fun. But dear colleagues, my take-home message is you don't have to buy a very expensive 3D printer or a very sophisticated milling machine to start to work with this new implant, because with the matrix implant, it seems to be that we have really a potential all-rounder to use, which gives you a lot of options to treat your patients. And with this, I want to thank you for your kind attention.
Wow, thank you very much.
You're welcome.
That was a firework. Wow, thank you.
You gave me only 10 minutes, so...
Yeah, but that was 10 minutes packed with information. Beautiful, really, really great done.
Thank you.
How was the matrix change your clinical in your daily practice? How does it change your daily life?
I mean, even though I told you, I told in the lecture that you don't have to buy or be fully digital, this was kind of a boost for our clinic too. So we bought the latest optical scanner, and yeah. Also, I think what João and Joel showed us in their lectures, that also the team approach with the dental technician is easier, because the files are you can easily send the files and so on. So I like it very much, and yeah.
I really like the word matrix is an all-rounder. And so do you see any indication where you cannot think to place a matrix implant?
Where you cannot think?
Yeah, because it's an all-rounder, and you think you can in your daily business?
At the moment, not. Maybe very, very narrow teeth, but with the bone level option, maybe this is possible too. So so far I don't see any limitations, except I don't know, maybe I have to ask you guys. I was thinking maybe that one limitation would be a cantilever on a single implant, and I don't know if there is any research so far. Joel, this works too. Okay.
I think also Joel decided to buy an intraoral scanner during this matrix, boost him into the digital world like you. Thank you very much for this presentation.
Welcome. Thank you.
Thank you.